Before I begin today, I would like to apologize. I apologize for the first 7 minutes of today's class. I apologize if you feel as though I have wasted this time for you, or if you feel uncomfortable or unnerved by anything I discuss, or the manner in which I discuss it. I know most of you probably don't even like me, and you find it torturous to have to sit here and pretend to care about what I'm saying. I'd like to invite you today into a strange world, where you are not allowed to enter a room or engage in a conversation until you have presented the audience with a opening statement, much like the one I just presented. I saw some of you react with very stale faces. I see some of you laughing for a very uncomfortable and appropriate response. That is the cause of an illness that is the most painful physical experience that you will never, thank God, have in your lifetime, and that is amplified musculoskeletal pain syndrome, or AMPS. AMPS is a condition that affects a lot of children, and not a lot of children, a very few minority of children, so luckily you will probably never have to go through this in your lifetime. But for the sake of conversation, I would like to educate you on it today. I'll be educating you through the medium of discussing me as in my process as I went through it during my junior year of high school. The way that I will explain this to you is I will begin with my morning routine, in which I will be attending a therapy to help treat this condition, and through that you will learn exactly what this condition is. Then we will go to school and see how this condition is caused, and then at night we will reflect on what this illness does and how it might affect my goals and plans for the future. It is 6:30 in the morning, and Riley is laying in bed awake. She's sprawled out on the bed, not wanting to get up, but not for the normal teenage reason. Over the course of the night, the blanket that was protecting her from the wool of her comforter slid off and grazed her leg. Her body began to respond as though her leg had been cut off at the knee. While this would be a normal sensation for a lot of people, Riley's condition reflected this in a very strange manner. Amplified musculoskeletal pain syndrome, or AMPS, is a pain that doesn't have any evidence of tissue damage, so it's extremely hard to diagnose. It is an umbrella term or a catch-all term that includes complex regional pain syndrome, childhood fibromyalgia, or all over various otherwise undiagnosable pediatric pains. Only 6 to 12% of the population, or the child population, even has this condition, which makes it extremely hard to get it diagnosed, especially when it's a catch-all diagnosis already. This results in a lot of people under the age of 20 getting misdiagnosed, having an over amount of drugs put into them to try and help this pain when it can do absolutely nothing, or even worse, have surgeries. Some people who have complex regional pain syndrome, which is where your hand might react as though it is constantly being cut off. And it's like your body is responding as though you're losing blood, and your hand is beginning to swell with all this blood because your body is treating it as though your hand isn't even there. They choose to just have their hand removed. When there are treatable options, but because they're not being diagnosed correctly, they don't know that, and they just choose to get rid of it before they can even solve it, because nobody knows about this. This information came from Elizabeth L. Kaufman. So, for Riley, the treatment of this almost undiagnosable illness begins with Children's Hospital and Med Center, specifically the Childhood Rheumatology Unit. In this program, the child, Riley, will have about an hour of psychological therapy, which helps her learn how to express the nature of her illness and how to address it within herself and talking to people, which is why it's really uncomfortable for me to talk about this, because it is almost a trigger for the illness itself is to discuss it. It's kind of as though people who have schizophrenia, if you acknowledge their delusion, it might worsen it. So although I want to educate you about this, it is extremely hard for me to, because it'll just worsen the symptoms that I have today. But I'm okay with that because I'd like to educate you all. Then she will also have about an hour of occupational therapy, where she will focus on desensitizing her body and retraining her nerves to fire in the correct pattern instead of these strange, constant fluctuations of pain. They can be intermediate or constant. And for Riley, they were constant, so her occupational therapy reflected that. The only way to treat this, people have found, since it's without surgeries or drugs is to just make your nervous system reset. Overstimulate yourself until your body just resets. So for Riley, her occupational therapy would be kneeling on a bath mat for 20 minutes and doing a puzzle until she was done with it. So she couldn't get off the bath mat that was stabbing her like knives until she was done with the puzzle. So I have some images here, and they are at my actual knees on 2 separate occasions of completing a session of occupational therapy. Although this kind of just looks like rug burn to most people, to me, my legs were gone. I would rather have cut off my legs than done that kneeling for that 10, 20-minute time period. The other portion of the therapy consists of traditional physical therapy, where I'd have to run an hour or do Zumba or something that would be more rewarding to other people or a positive sorts of exercise. But my body, until I was finally able to retrain it, was telling me that I was dying. It was not an appropriate thing to be doing at the time because my body just didn't know. So now that I have shown you what the therapy and the treatment of this strange condition looks like and introduced it to you, I'd like to talk about how it's even caused, because as children yourselves, I doubt you would ever want to get to a point where you would have this sort of pain, especially if you're athletes or something like that. So the big how it's caused is we don't know. It's such an umbrella term and such a strange condition that we genuinely do not know how this arises in children. It is, however, noted that it is at least casually related to injury, stress, or psychological trauma. For me personally, it was the latter. It was psychological trauma and stress. Over the course of my beginning high school career, and as we move into the high school setting, this will be more relevant, I was experiencing a lot of bullying and trauma from teachers and classmates, and it was a very sad situation. So in high school for me, my high school experience looked like a statistic. As well as being injury, psychological, stress related, it is also somehow related to a socioeconomic standpoint and a gender. More than 80% end up being of a higher socioeconomic standard and female. And it's speculated this is because they are, I don't want to sound biased as meeting those standards, but it is noted that they are more expected to be you wouldn't expect them to have a lower class sort of condition where they are seeking attention for pains, as much as that sounds really awful, but that is much of the speculation. So I met both of these qualifications, and I had the psychological and stress injuries that come along with it. The mean onset, however, is 12 to 13, and unfortunately I was about 15 to 16. So that one was a little hard to catch. And all this information comes from David D. Sherry, who is a top expert on AMPS, and he was part of his spectrum of how to diagnose is how I even got diagnosed. So as we walk into school, I want you to see what I am going through and how it is treating my body. I'm going through psychological stress. I meet all the qualifications for this illness, but it's not getting diagnosed. You now understand that it's age and it's economics and it's stress and it's gender. But the actual physical how is it's caused by an outsource of what would otherwise be normal stimuli. So, for example, if I were to stub my toe, a normal response would be, ow, that hurts, don't do that again, and your body would just reset and be fine. But for me, or anyone with AMPS, they would stub their toe, and I would like to motion to this picture as much as I can. They would stub their toe, and the stimuli would go into their spinal cord, and somehow it would mess up, and your body would start to overemphasize it and start resetting the signals, and there would be a circular pattern of the nervous sensation where there's a break in your spinal cord, not literally, but in the nervous system itself, there's a break where it just keeps repeating and keeps repeating. So it feels like your body is being hit with a hammer. Your toe is being hit with a hammer instead of just being stubbed. And it increases and there's an increase in lactic acid and other sorry, I'm blanking on the biological term. There are other symptoms that come along with this that would normally be associated with something physically wrong in there, but there isn't. It's just in the nervous system instead of actually showing up on the body. So it's important to consider how someone with this illness would see their future. So as we come to bed tonight, let's look at our dreams and assess the future for ourselves. The idea with the resetting the nervous system and the very intensive, invasive treatments, such as what I went through, is to get that person or child back to experiencing a normal life. For me personally, I'm about a year out of the outpatient program, and while some days are worse than others, some days I'll still have the pain, there's a lot of hope for me. Children's Hospital of Philadelphia, they put together a grouping of 103 patients who had type 1 complex regional pain syndrome. And they looked at them over the course of about 5 years and how their condition was improving or unimproving. They were monitoring their physical evolvement over time. So it was 100% immediately after the treatment were back to living their normal lives, which is a big deal because before that they were unable to do more than anything. They were unable to do nothing. A lot of people end up being in wheelchairs before they get diagnosed. It was only 92% who had absolutely no pain. So there was still that 8% that was experiencing pain, but was still able to go to their normal life. And at the 5-year mark, 88% were able to say that they are okay. So for me, moving into college, I have to be aware of these statistics because I am very much a part of them since I meet so many of the criteria that we talked about previously. I could very well in 5 years be part of the 88% or the 12%. It could go either way. So what I have to do as a person who has this illness is I need to be aware of what causes it. Like getting up in front of you guys and talking about it causes a lot of pain for me. I need to be aware that if I have to do something like this, then I need to plan out the rest of my day to incorporate treatments for the pain that I am feeling now. Or if, as I'm going to college, I need to think, okay, I'm not going to be home. I'm not going to be around the doctors and the people who actually know what's going on. I need to be able to take complete control over my own treatment. And I need to be ready with a TENS unit that shocks your body into feeling better, or ice packs, or heat packs, or have a gym membership wherever I'm at so I can go and work out and get my body back to calming it down. So because it's such an individual process, it is a little bit hard to catch all these statistics, but the way they do this is through something called the FDI, which is the Functional Disability Index. It's this little sheet of paper that says, walking the length of a football field, no pain, intense pain. And you mark off where you land on it, and they measure you up, and then they can show you an actual number to a diagnosis and an illness that is otherwise completely invisible. All this information came itself from the Children's Hospital of Philadelphia. So now that you understand a little bit of what amplified musculoskeletal pain syndrome is, hopefully you can appreciate the gravity of what it is when I tell you that I am in a very better place and a very better situation. Toward the beginning of our speech where I talked about the morning and what the therapy looks like, I'm a year out of the therapy and I am no longer, I don't even have to check in with them anymore. I'm doing really well on my own. In my daily life, I'm able to incorporate these sorts of treatments to myself. If I end up in a stressful or psychologically kind of invasive situation, I know what to do to make myself feel better during and after it, thanks to the therapy and everything I did. My legs are nowhere near as sensitive as they once were. I'm able to be hugged again. And if I ever do feel that sort of pain, I know how to desensitize my body. And I know that I can kneel on a bath mat or something like that. And then when we went to school, I was able to see the psychological and stress causes behind this, where I now know I made some adjustments to my life that got me out of those painful situations, such as I quit band and focused on choir because band was the bad place and choir became the happy place. So I was able to make that adjustment in my personal school life to help eliminate those stress factors. I can't help the fact that I'm a woman or that I am of a high socioeconomic standpoint, but that whole idea was lessened once I made those other personal changes. And then at night, as I'm reflecting on the future and thinking about how I can live with this or without this, I have gotten to a point where I feel very comfortable in myself and who I am. And I feel very confident that whether this stays with me for the rest of my life or it leaves for the rest of my life, I'm going to be happy, and I can accomplish things. The same amount of what I want to accomplish can be done in either path of my life. So before I close out today, instead of introducing myself with a derogatory air, I would like to genuinely thank you all for not only listening to me today, but helping me in my therapy. Although you didn't mean to, getting up and talking about this is a big step into relieving myself of a lot of this pain and trauma. So thank you so much for listening to me. I hope you enjoyed, and I appreciate you all.